A little bit deeper into this, joining us now to talk about it is Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna COVID-19 vaccine trial. We always appreciate you joining us, especially when we have new information. We talked about this new variant last week and how contagious it was. It was certainly here in Wisconsin. It will likely become the dominant strain here in the country if it's not already. With that, the U.S. has just extended the public health emergency status for COVID. What is your take on that? Do you think that's necessary?
I do think it's necessary for right now. COVID is still responsible for somewhere between 400 and 500 deaths of U.S. people every single day. And so this is still an extremely high number and a number that we really don't want any part of. And so we have to extend this public health emergency so that the government can continue to fund the testing, the treatments, and the vaccines needed to keep ourselves safe and our communities safe.
It's a good thing you point out. I think a lot of people, when they hear that public health emergency, what does that actually mean? It doesn't mean there's any sort of mandates in place. It has a lot to do with funding and how the government's able to utilize those resources. We just heard about that new variant now prevalent here in the U.S. Doctors, of course, and you as well, always advise to make sure you get vaccinated, boosted if necessary. But at the end of the day, some people just don't like shots. I do not like them, although I do get them. But that's enough for some people to say absolutely no to the vaccine. But they could be in luck with the few developments that are happening this year, right?
Right. We're hoping to see the first inhaled or nasal preparation of a vaccine. And the importance of this is that the immunity that we're hoping to induce with an inhaled vaccine is called mucosal immunity, or in the layer that's even closer to fighting the virus as it comes into contact with your body. And so we're bringing the fight to the virus at the site that the virus wants to enter. So right there at the tip of your nose, we hope to have those antibodies that can fight against this virus and prevent people from ever developing symptoms.
Logically, it makes sense. So hoping for this year. We'll obviously keep our viewers posted. Lastly, before we let you go, let's talk long COVID, because a very interesting study just came out saying that the median age for long COVID was 25.
Right. And so in this study, which is the largest of these long COVID studies that have been done to date, the average age in this study was 25. What it showed, though, was that the long COVID symptoms for most people resolve after about a year. And it was this age group of 40 to 60 that seemed to suffer the worst symptoms. And people who were unvaccinated seemed to have worse symptoms than people who were vaccinated.
Kind of reigns true to what we've been seeing all along. So we appreciate the insight as always. We'll have you back next week, Dr. Bill Hartman. Thank you.
Thank you.